Organic produce can get expensive, but is it worth it? First of its kind research is being done at Boise State University, attempting to find a link between eating non-organic produce and neurological issues for babies while in utero. And that research says it might be worth the cost. In this 6 on Your Side exclusive interview, our higher education reporter McKenna King spoke with researchers on their findings.
That research is being done here at the Environmental Research Building at Boise State University. What they found was that pregnant women who consumed mostly organic produce had significantly lower pesticide exposure than women who ate mostly inorganic.
The reason people might care is because the reason pesticides work is because they kill things.
The big question, though, are they killing brain cells and causing babies to develop things like behavioral disorders?
We don't really know yet whether the level of pesticide exposure you get from your diet is actually harmful, but a study like this is going to help us figure that out.
So they gathered a sample of 20 women, a small sample size, but they followed them as early as their second trimester through the end of the pregnancy.
And then we compared the groups in terms of pesticide metabolite levels in their urine.
Gathering nearly 500 total urine samples from the women. 10 of them ate strictly inorganic produce, while the other 10 supplemented their diets with organic produce but didn't eliminate inorganic completely.
We still saw this dramatic reduction, which means if you're adding organic food to your diet, you're still changing your pesticide exposure.
People have been eating food sprayed with pesticides for decades, so why the push now to look into what we're actually consuming?
For the individual person, you might not see that much of a difference, but if you're shifting the whole population, 1 IQ point, or if you're shifting the whole population's likelihood of ADHD, then maybe that might be important.
This was a bit of a pilot study for Curl and her students, and now she's hoping to expand it.
Recruit more women, something like 500 women, and then be able to follow their kids and look for differences in health outcomes.
Taking action for change from the start. Curl says even if they do find a health benefit from consuming organic foods, she hopes ultimately they can find out what the chemical is that's causing those negative effects, ultimately eliminating it from food for everyone, not just those who can afford organic food. At Boise State University, McKenna King, 6 on Your Side.